Exhaustion mixed with frustration. Frontline healthcare workers say people still are not taking this virus seriously. Here's what else they told us.
I'm pretty much fighting two wars. A war against COVID and a war against stupidity. And the problem is that the first one, I have some hope about winning, but the second one is becoming more and more difficult to treat because people are not listening. Whether it's, we're backed up by science or just plain old common sense, people are not listening throughout the country. I have been in the middle of earthquakes, in the middle of bombings, in the middle of tsunamis. I've been in every possible catastrophe that you can imagine. And by far, this is the worst. The other ones, something bad happens and then you run, you take care of things, and that's it. Here continues to occur. The thing that annoys me the most is that we keep on doing our best to save all these people, and then you get another batch of people that are doing exactly the opposite of what you are telling them not to do.
I worked this past Wednesday. I had 3 patients. I wasn't feeling too good towards the end of the shift, so I let Dr. Varone know. And he was like, you need to get to the ER. They told me I was positive. You're in your mind going, where did I go wrong? What did I do wrong? This is what I wear. It messes with you. All the fighting and all the screaming and all the finger pointing. Enough is enough. Whatever happened to just common humanity and decency? People just need to stop and listen to us. We're not gonna lie. Why would we lie?
Schools are starting to reopen across the country, and there are still so many questions about COVID-19 in kids. Here's what Dr. Fauci told Congresswoman Maxine Waters earlier today.
If you're talking about a conclusion that children in general are immune, that children do get infected, we know that, so therefore they're not immune. Okay. I mean, I must just say, Congresswoman, that when children get infected, that when you look at the deleterious consequences, they generally do much, much better, because if you look at the hospitalizations, that children have a much, much lower rate of hospitalizations than adults. In fact, the curve goes way up as you get older and older. And when you get to the age group of children, they generally do not get serious diseases.
Dr. Thomas Tsai joins me now. He's a surgeon at Boston's Brigham and Women's Hospital and a health policy professor at Harvard. Dr. Tsai, Dr. Fauci is saying there that generally children don't get serious or life-threatening symptoms, but their teachers and parents could. What kinds of concerns do you have about children as COVID carriers?
Thanks for having me on the show. I think it's important to think about this in 2 ways. One is the risk of the school children to exposing the adults at school, such as the teachers and the staff, and then what that means in terms of bringing the potential infections back home to the family cluster. The overarching message remains that the best way to reopen schools and minimize any risk of transmission in the schools is actually to protect and reduce the risk of transmission in the communities. By reducing the transmission in the communities, that's the best way to guarantee safety for our school children as well as the teachers in the schools.
Dr. Tsai, what can schools do so they don't have to shut down every time a student or a faculty member tests positive for COVID-19?
The schools can do several things. The CDC has put out guidelines for schools in anticipation of schools opening. So there's some preparation they can do. There's actions they can do while schools are open. But what's most important is, again, first and foremost, to contain the pandemic and suppress the pandemic in the communities, because that creates the conditions for a safe opening of schools. And then the situations where the communities have a very high burden of COVID-19, it may be better to postpone. But that said, schools can make sure that they follow all the physical distancing guidelines. We also need to do this by prioritizing and think about the children in three different categories. The elementary school children should be the first priority for in-person education, followed by middle school age children, and lastly, high school age children. The older children may have a higher risk of transmission of COVID-19 to their peers or to teachers or even to the family members, but they're also more amenable to virtual learning options. And we should make a priority of having our school age, elementary age children having in-person learning. But that may also mean spreading the classrooms out and not just concentrating them into the physical buildings of the elementary schools, but taking advantage of other physical spaces and outdoors.
Dr. Tsai, what role should schools play in testing for both students and teachers?
So I think there's an important role for testing. Now, the CDC does not recommend universal testing, at least for K through 12 schools, but that's largely driven by a fear of a lack of capacity for tests. And the way to around that is to make sure we have enough capacity to test and really let the public health guidelines and epidemiology drive our decisions and not limit our decisions because of existing supply chain deficiencies. But the principles of contact tracing still follow. If there's a student that tests positive in the school, you want to make sure you contact trace all the students in that classroom, and then also test those students, those teachers, those staff members, anybody that's in a close proximity of those students as well. But schools need to be prepare for this ahead of time. Schools need to communicate that this is a very dynamic process, which means that the solutions aren't just about a school, but we may need micro solutions for each classroom in case there's a cluster of infections in the classroom, so you can potentially shut down a classroom but keep the rest of the school open. And then there's obviously concern for a wider school shutdown. But this has to be communicated very clearly to parents that this is going to be a very dynamic process, but we need to be planning now and not waiting for these events to happen.
Dr. Tsai, Dr. Fauci says that he is cautiously optimistic that a vaccine will be ready by late fall or early winter. How dependent is that vaccine's success on the majority of people actually going and getting vaccinated?
That's right. The way a vaccine works is to create herd immunity, but vaccines are different from vaccinations. What we need is a higher rate of vaccinations. That means individuals actually receiving the vaccines. So that's the most critical part. Getting the vaccines produced at warp speed is one piece of the puzzle, but the other piece of the puzzle is making sure that we combat any misinformation about vaccination, and also start developing plans for how are we actually going to manufacture and distribute the vaccines in an equitable way so we can actually get high vaccination rates in early 2021.
So many things to think about as people prepare to send their children back to school or think about keeping them home. Dr. Tsai, thanks for talking through some of the issues with us. We appreciate it.
Of course. Thank you.
More than 1,500 students and over 100 faculty members went back to school in Jefferson, Georgia today. Students there won't be required to wear masks, even though there are now more than 180,000 coronavirus cases in the state. NBC News reporter Ali Vitale is in Jefferson, Georgia. Ali, what are the safety rules in Jefferson schools today, and how has the first day gone so far?
Well, you got the headline, Allison. No masks are required, though in a letter that the school sent to parents, they said students should be encouraged to wear masks, as well as, where possible inside the school, socially distance from each other. But there are the realities, and you and I talked about this last week, of being in a classroom with 4 set walls. Space is at a premium here, and so when you're wanting to social distance, these schools are trying to figure out the best configuration for desks. They're trying to make certain hallways one way so that you don't have people crisscrossing paths with each other. But the big headline here is the fact that despite all the hand sanitizing and the hand washing and the attempts to social distance, masks are not mandatory in Jefferson today.
Ali, I know you spoke to 2 students who actually started a petition to make masks mandatory. What did they tell you?
Well, these 2 rising seniors started this petition in response to the fact that the school administrators weren't going to do it. They asked the superintendent as well as other officials at their school if this is something that they could mandate. And of course, you're right. They got online with a petition about it. That petition was met with some support and also some derision. There was a counter petition that was started saying that they didn't want a requirement to wear masks in the schools. And so it sort of hammers home the point that this public health crisis is inextricably linked with the politics of this moment, and in this case, the politics of mask wearing. But to these two girls that I spoke to, in fact, we caught up with them right before they went back for their first day of school. They said to them, the politics aren't anywhere in this. Listen.
It's not, to me, it just is about the safety of students and faculty in our community, but yeah, a lot of students do involve politics.
A lot of kids don't think it's really like the mask wearing, they just don't want their rights taken away.
Yeah, but they've never had a problem with dress code or anything else.
And that was actually something, Allison, that I had never thought about. We have had rules about what you have to wear in school for a while. For me, when I was in high school, it was that your straps had to be, you know, this thick, or your skirt had to be X length. And there were dress code things that we all accepted. And so it was interesting that these students put it in those terms. But I will say, although it's not about the politics to them, and officials across the board have said that this is not a political moment, all you have to do is look on the petitions online and just see some of the comments that are there. I mean, there are things that say Trump 2020 and conservatives this, liberals that. And so it's very much linked with this decision here. And when you consider where we are, it sort of makes sense why there wouldn't be a mask mandate. This is a place that went 80% for Trump in 2016, I believe. So overwhelmingly a red area, a place where, you know, they listen to what the president has said on this. And he's only come to this mask debate late in the game, only in the last few weeks.
Allie, it's so funny you said that about school. I went to all-girls Catholic high school, so we had a whole lot of rules about what we could do when we went to school. So believe me, we just did what we were told. The nuns were in charge.
You're living
let me ask you, what is the overall vibe? Right? What is the overall vibe in Jefferson today? I mean, it sounds like this is a town divided on what's best for its students and its schools. And as you said, the politics is really playing a bit of a role there.
This town and so many others, right? You come to these places and we shine a spotlight on them as microcosms of this larger debate that's happening across the country. I mean, you and I talked last week, or earlier this week rather, about the teachers and their considerations in coming back into the classrooms. Parents and students are also involved in this debate too. We even had one woman talking with us this morning saying, just let the kids go back to school. So there are people in this community who want to see the kids back in school, back at their desks, learning the quote-unquote old normal way. But we are very much in a new normal, and so it requires thinking through what the ramifications of physically going back to school look like. So this is clearly one of the first places on the map that's going back to school. I know that a lot of schools in the northern regions of the country, for example, they start a little bit closer to September. So really, this is one of the places we're going to be looking at as we start seeing, okay, what are the ramifications of getting kids back in the classroom? And there is a world in which if you're a parent here and you don't want your kids to go back to school, you don't feel comfortable physically putting them back in a classroom, you can opt for an online learning approach. But even there, that's not something where you would have Jefferson High School or Jefferson Middle School teachers up there. There's one that's run by the state and there's one that's run by a third party. So there is that option that exists, but most people probably have their kids back in school today, judging by the parking lot, which was pretty crowded this morning.
Allie, I have to say, I'm very impressed with those two young women and their initiative. We're seeing young people across the country really be responsible, really worrying about their safety and their classmates. Super impressed by those young women today.
Yeah. Me too. Me too.
Thanks, Allie. Texas is moving ahead of New York in total coronavirus cases. More than 431,000 people in the Lone Star State have tested positive. Nearly 7,000 have died. NBC News correspondent Morgan Chesky joins us now from the Neighborhood Family Medical Center in Dallas. Morgan, if I'm correct, you're at one of the first private clinics in Dallas to offer testing. What is demand like there?
Yeah, Allison, it's been really interesting to come back here because we reported from this location about 3 months ago, back when the pandemic really started to take hold here in Texas. And I had a chance to speak to the doctor who runs this clinic, and demand has been an interesting thing to follow here. Initially, when this clinic opened up, one of the first, as you mentioned, the people coming here were incredibly sick, very symptomatic, those classic symptoms, difficulty breathing, high fever, and pains throughout the body. Since then, though, the doctor tells me that demand has gone up, but the cases appear to be milder. People here either don't have symptoms at all or reduced levels of those. However, they are still testing positive, and that's why he's had to hire extra staff at this clinic just to make sure that they can see as many people as they can, which what began with a max of about 100 cars a day has now been expanded upwards of 300 cars a day. And so there's no real end to that. The people keep coming here because there is such a need for testing, for quick results, and they offer rapid testing here at this one location, one of the few locations that offers that, as those machines are certainly in high demand right now and are few and far between. Allison?
Morgan, what has this been like for doctors who are trying to treat patients as the numbers just keep going up there?
It's been frustrating. I know the doctor here tells me that he wanted to see progress, but really at this point, when you look at the numbers across the state of Texas, while hospitalizations and while daily new cases are at least stabilizing and starting to go down, the death count just yesterday was the highest that Texas has seen since this pandemic began. 322 people died as a result of COVID-19. More people died in Texas in the month of July than in any other state in the country. And you can hear some of that frustration evident in his voice when I spoke to him earlier. Take a listen to what the doctor had to say just a few moments ago. What's been the most frustrating part for you as a doctor, seeing these patients every day?
The frustration of dealing with people who don't think this is real.
Still.
I had a 15-minute long conversation with an established patient yesterday who was convinced this is all just a hoax. This is not real. This is all made up. And it's very frustrating for me, and I'm sure a lot of other healthcare providers, because we'll talk ourselves till we're blue in the face, and sometimes you just can't convince people otherwise.
You know, we've been conditioned to talk about numbers and testing and lab results and the speed at which they come back. But Allison, the doctors that I've spoken to say if they could change one thing at all, it would be attitude. It would be approach to how this virus is viewed by the public.
So Morgan, to that end, what needs to happen to turn this around and stop those numbers there from rising?
You know, doctors say that certainly more people getting tested is a positive, but the testing really falls flat unless you have prompt results. And we know that for a time, especially in latter June and throughout the majority of July, the lab results were taking too long to come back to people, making it really tough on contact tracers and on people just unsure of whether or not they had to stay at home and self-isolate or if it was safe for them to go out and about. So that certainly needs to continue. But the key word here that we're hearing is education. The fact that there is still doubt in people's minds as to whether or not this virus is real, whether or not this virus is a threat, and the danger it presents is highly concerning for the staff here because they're working long hours. They're treating as many people as they can. And yet there are still people that pull up here to this clinic to get treated for either a test or another illness who are openly unsure about whether or not they should take this seriously. Allison?
Morgan, I'm hearing also there was an issue with this week's fatality count. What happened there?
Yeah, this was really interesting. The state of Texas, in an effort to become more accurate in its official death toll, switched in how they're recording the deaths, and they went from taking numbers from county and local municipal agencies to solely relying on death certificates. And they had to strike a number of deaths, more than 200, in fact, from the official death toll for the state, because those death certificates that were recorded gave COVID-19 as a contributing factor to the death and not the sole factor in the death of those individuals. So they changed to these death certificates because they believe it's the most accurate way of recording the impact of the virus here in the state. And so fortunately, they were able to catch that, correct the number. But even so, Texas recording now more than 6,000 deaths so far. More than 1,000 of those came within just the past week, and that's incredibly concerning. Allison?
Yeah, very much so. Morgan Chesky in Dallas, thank you so much.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.